Good morning, ladies and gentlemen. Welcome back to another Sharewise webinar. My name's Harry McCaskill, one of the advisors here. I'm looking forward today. We're very lucky enough to have Michael Kotsanis, the Managing Director and CEO of ACR, which is a ticker code of Acrux. And, you know, he's got a few key points he wants to touch base on and I guess reach out to those listening, answer any questions. But first of all, obviously go through a bit of a presentation. I don't want to take much away from Michael. I'll let him introduce the business and I guess a few of the key topics he wants to go over. It is recorded, so feel free if you are sort of busy or whatever, it will be recorded, so you'll have the opportunity to watch it after or another time. Also, put in any questions you have for Michael. I'll jump in, make it a little bit more interactive, and it should be really, really good. But Michael, on behalf of Sharewise, I just want to thank you for your time, and you know, we're pleased to have you.
Thank you, Harry, and thanks for those people who are attending, and appreciate Sharewise inviting us to speak. It's always good to connect with interested parties and shareholders and potential investors as well.
Yeah, for sure. It's a pleasure.
I'll share my screen and kick off the presentation.
Excellent. Let's get into it.
Okay, can you see that okay?
Yeah, perfect.
Perfect. Okay. Yeah. So Acrux. Acrux is an ASX listed company. We've been listed since 2004. We're a Melbourne-based pharmaceutical company who focuses on topically applied prescription pharmaceutical products. That's our expertise, that's our core, that's our DNA. I'll take you through around a dozen slides which describe the company, and obviously I'd welcome questions at the very end. Can you still see those slides okay? My screen?
Yep, everything looks good on our end.
Okay, so you can see the disclaimer slide at the moment?
Yeah, perfect.
Yeah, perfect. Sorry, my screen jumped around. This is the standard disclaimer slide. I'd encourage you to read it. I will be making forward-looking statements and this standard language, but certainly read it. It'll be in the presentation afterwards.
Perfect.
Acrux is an Australian-based company. We're Melbourne-based, actually. All of our employees are based in Melbourne. We're a leader in the development of topically applied prescription pharmaceutical products. We were founded in 1998, listed in 2004. So we have over 25 years of experience in dealing with regulators in the US, Europe, and other countries. And we've had a number of products approved in those years and commercialised as well. We certainly have the skills and competence to meet complex FDA product-specific guidances for generics or ANDA development, and that's demonstrated by the approvals we've had over time, particularly from the FDA and other markets as well. We have a network of contract manufacturers that we work with. We have 8 contracted manufacturers, all FDA approved, and those companies manufacture the products for us both from a regulatory perspective and also from a commercial perspective. And in addition, we have a number of licensees that we've licensed our products to. All of our near-term products are actually licensed to commercial partners for commercialisation in the US and beyond. This is the pathway we've been on. In 2017, we started working on a portfolio of generic topical products, focusing on the US market. We saw a number of opportunities there. We've grown our portfolio from early days to today. We have 15 products in our portfolio. Portfolio includes those products in development as well as those on market. 2021, we received our first approval, and today we have 5 products approved. 3 have been launched, 2 are pending approval, and we've got some other additional products to be launched soon. So we've got a strong pipeline of products under development, and we also generate revenue from our commercialised products. In fact, we've generated 20 million Aussie dollars in revenue over the last 2 years. Probably a good first question is, what is a generic product? And I've just included here 2 different definitions. One's from the Australian Therapeutic Goods Administration, and the second one is from the FDA, from the United States. Effectively, they're very similar. Europeans are similar as well. Generic medicine is an additional brand of an existing drug. It's got the same ingredients, same chemicals that make the medicine work as effectively and as safely as the product that's on the market. These products are developed, they take some years to develop. We submit our dossiers to the regulators, whether it's the US or some other market. the US regulator will review that dossier, and when they're satisfied with the contents of the dossier, they certainly have the opportunity to ask questions. And when they're satisfied, they will approve the product. And approval means that they are approving the product as being bioequivalent, so the same effect as the product, the branded product the patients have been taking in that country. In other words, as it says to the bottom of the FDA page there, you can take a generic medicine as an equal substitute for the brand name counterpart, and you can expect the same results. There's an overview of the company. We have, if you start at the bottom there, we have a large number of products that we review to identify products to put into our pipeline. I'll go through that more shortly. Of all those products down the bottom there, we have 7 products, additional products in development. They're all generic products. They're focused on the US market, although we are talking to a number of companies outside the US. As we get approvals, we find that we're able to engage with companies outside the US to leverage that FDA approval into other markets. We have 7 products submitted so far to the FDA. 5 of those are approved. We've launched 2 recently, and we have 3 products on the market that are generating revenue for us today. A little bit about our products. So we launched the product on the top left-hand side here is prilocaine lidocaine cream. That's a local anaesthetic. It's approved use in the US. This is a topical anaesthetic for local analgesia. It was launched at Christmas time 2022. And we see this as an important product for us in the future. It will certainly grow. The product is quite high volume, and it was approved prior to its launch in 2022. The partner for that product is Patagus, which is one of the largest topical generic companies in the United States. On the right-hand side, you can see the product Dapsone. Dapsone 5% comes in 2 strengths. We've actually got both strengths. Both are approved. One has been launched. And the top right-hand side, you can see Dapsone 5%. That's approved for the use in acne vulgaris. Obviously, an indication mainly in teenagers and young adults. And we've launched that through our partner, True Pharma, and they're commercialising that through the United States. So they're 2 recent launches. We've got 2 more products planned. The 3 products down the bottom there that you can see are the 3 products that are under FDA review. Dapsone 7.5%, which is a higher strength Dapsone, also for acne, but indicated in children over 9. Nitroglycerin, which is an ointment for pain from anal fissure, and acyclovir cream, which is for cold sores. And in addition, we have another 7 products under development, and we continue to add products to our pipeline. So that's 7 products. As we get products approved, we add additional products to our pipeline and move on. We focus on a niche called topical pharmaceuticals. Topical refers to the way in which the drug is applied. So you can take medications orally, you can take them by injection, you can take them by inhaling them, inhalation, and there are a number of other dosage forms as well. We focus on a niche called topical, which is drugs that are applied to the skin or the eyes or the ears or some other body surface. That market is around $21 billion in size. It's 4% of the US market. The US market's around $500 billion. And dosage forms are quite varied. It could be ointments, suspensions, solutions, pastes, gels, creams. And each of them requires has different characteristics and applies to different dosage forms that we develop. We develop both sterile and non-sterile dosage forms. So we have some manufacturers that we work with that work on non-sterile versions, so creams and ointments for the skin typically. And we also have some manufacturers that we work with for sterile products, which we also have an interest in for eyes and ears in particular. The development of topical generics is generally characterized as being more complicated than an oral medication. That's why you also see less competition in that sector of the market. Oral medications, when they're proven to be bioequivalent, it's usually by a simple pharmacokinetic test, whereas the demonstration of bioequivalence for topical pharmaceuticals can be quite varied. It varies according to the different drugs and the different uses, whether the drug's absorbed into the bloodstream or whether it has a superficial action on the skin. If we look at our target market of topicals, there's quite a variety of products that are available for us to develop. And we look at this constantly and are trying to identify the next product to add to our pipeline. And you see there, these are categories that are defined by IQVIA, which is a market industry source of commercial data, sales data. You can see the list there: topical dermatologicals, ophthalmics, patches, nasal products, throat products, etc., etc. And we've categorised these into the larger products, which generate over $100 million in sales on the US market only. Then there's those products which are more medium-sized and those products that are smaller. And we look at all the products within this universe. We constantly refresh it because products obviously grow and shrink over time as usage might increase or decrease. We also use this as a guide to identifying any patents that may be in place that protect the branded product. We also look at other data sources and databases for information that helps us identify which products we will add to the pipeline. We will add two products a year. So of these 217 or 200, almost 300 products, we do add a number of products to a bucket, and we assess those in more detail. And over time, it probably takes about 6 months for us to identify a single product which we add to the pipeline. This is our development pipeline and approved product pipeline. If you start on the left-hand side there, you can see that in the development phase, we have 7 topical prescription products in development. We don't disclose what they are. That's for competitive purposes. We don't want to tell our competitors what we're doing. Under FDA review, we have disclosed these products. We've submitted, and under active review is nitroglycerin rectal ointment, as well as acyclovir cream. Recently approved, we had Dapsone 7.5% gel. That's a high strength product for acne, as I've mentioned before. And on the market today, we have Dapsone 5% gel, which is also marketed for acne. It's not substitutable, which is an important term in the generic market, whether a product is substitutable one for another. It's not substitutable for the 7.5%. They compete in discrete markets in the United States. As I've mentioned, we also market Prilocaine lidocaine cream. That's a high volume product in the US, commonly used for procedures requiring a local anaesthetic. And we also have Evermist, which is for hormone replacement therapy in women in the United States. That's marketed by a company called Patagus as well. And in Europe and some other markets, we have our estradiol spray, which is marketed by Gideon Richter in around 40 countries as well. This is the portfolio of products we have under development, broken up by competitive profile. And we put this together because we believe that the topical market represents a market which has lower competition than other sectors like the orals or injectable markets, partly due to the market size being smaller, but partly due to the complexity in development. And we're one of the few companies that have the capability to develop topical pharmaceuticals to the US market and get approval. And we've demonstrated that consistently through our history. On the right-hand side there, you can see a large dark blue portion of the pie, which is 702 million. They're the products in that category are products with no competing marketed generics today. And if you go around that pie clockwise, we've got one product which has got $23 million in sales, which has one marketed generic. Then we have a category 170 million. That's products in that category have 2 marketed generics. And we have 3 marketed generics. There's $268 million worth of market value there. And then we have some products with 5 marketed generics as well. So overall, that's a pretty pleasing profile. You don't see the level of competition in topicals that you do see in oral products. Obviously, the fewer competitors, the better. For us, from a consumer point of view, you want to see competition, of course. So we welcome competition as part of the generic business. At the same time, we also look for products with low levels of competition on the market when we start developing them. This is our process for identifying and developing drugs. So we spend, as I mentioned before, around 6 to 12 months identifying products to put in our pipeline. That's a very detailed review of the commercial data, of the patent data. We often engage with the FDA to identify formulations and help them get them to help us identify what the right formulation is. We also put together a business case on each product and then stack them up one by one, side by side to compare and identify the next product to add to our pipeline. We then put the product into our laboratory. There's 25 specialised scientists within Acrux. They have the skills to develop the product, identify the formulation, develop it into a stable formulation. We then work with manufacturers who have contracted. Those manufacturers will manufacture product for commercial purposes, but also importantly for regulatory purposes. So when you develop a drug, you have to demonstrate from a regulatory point of view that you can manufacture batches, usually 3, and you use that data for regulatory purposes. That data combined with the bioequivalence data we generate is submitted to the FDA for review. And once they're satisfied that we've answered all their questions, they will then approve that. That product is then launched, and we commercialise those products, not through Acrux, but through commercial partners in the United States that put their brand, their logo on the product, and pay us a royalty or a profit share in return for the commercial rights to the product. We do have a lot of expertise in negotiating with those partners. We have a number of licensing deals on a number of products. All the near-term products already partnered, which is good. We actually have a number of companies that approach us, both in the US and offshore, outside the US, for access to our products for commercialization in their markets. Our core model, like all business focus, of course, is on drug development, and that's the engine room which drives FDA submissions, product approvals, product launches. So to summarise our capabilities, we have an R&D focus. We've got an on-site laboratory here in Melbourne, in West Melbourne. It's GMP licensed that was inspected by the TGA some time ago, and we have a TGA inspection license, and was also inspected recently remotely by the FDA for a bioequivalence approach that we took on one particular product. Whether it's the FDA or TGA, the inspections have gone smoothly for us. All the early development process is conducted at our labs in Melbourne, and these pictures are of real people, not models. They're our staff. Bioequivalence testing is conducted to meet FDA product-specific guidelines. The FDA publishes what we call product-specific guidelines, which anyone can look for a number of, or thousands of drugs actually, and they will comment on the bioequivalence pathway and the testing that you need to do to show that a product is bioequivalent with its branded comparator. Those product bioequivalence tests can be quite varied. In vitro tests, which is IVRT or IVPT, typically in vitro release testing or in vitro permeation testing, pharmacokinetic or PK testing, and there are other specific requirements, particularly what we call Q1, Q2, Q3, which is similar, same ingredients, same concentrations, and same properties. And we've had approval of products based on both in vitro testing and also in vivo testing. And that's a fairly specialised set of skills that not many companies can demonstrate as well. The growth of the business will be based on both products we've got in market now, which are continuing to show good form, as well as 2 more product launches that we're anticipating in the next 5 months. We are generating revenue from commercialised products. I mentioned before that we've generated $20 million in revenue over the last couple of years. We do have two additional products under evaluation by the FDA. We do expect one of those to be approved in the near future. And we have had a track record of 5 approvals since 2021. Is good going, and we expect more approvals, obviously, as we file more products and get more products approved and bring them to market. Our product development pipeline is strong. We maintain a fairly consistent number of products in our pipeline under active development. That means people in our labs working with those products or working with manufacturers to manufacture regulatory batches. And that we continue to add to that pipeline as we identify products and have the resources, both financially and human resources, to develop additional products. This is our corporate and share price overview. Our ticker is ACR. We have a small market cap. The share price has ranged over time, as you can see from the graph, and our largest shareholders account for around 34% of our shareholder shares on issue. If you'd like to connect with Acrux, there's a number of ways, usual ways, LinkedIn. We have a website, of course, or you can email us. We're always happy to interact with shareholders and investors, and welcome your interest.
Excellent, Michael. We've had a couple of questions come through. Obviously, the business has got a lot of key milestones you want to be achieving. Obviously, it's a step by step. It's a patience game at the end of the day, right? But we've got one here from Kush. He's asking, could you please give us an update on Jublia? When can we expect this product to launch?
Yeah, sure. So Jublia, which is the is the brand name, is efinaconazole. It's an antifungal for toenail fungus. So there's obviously someone asking this question that has good knowledge about the company. It's quite a large market in the US, and there are a number of products, a number of companies that filed the product and also filed what we call a paragraph 4, so they challenged the patents. All those companies have actually settled the patent litigation, including Acrux, and all those companies have settled the patent litigation with a confidential contract around the timing for launch. So much as I'd love to give you a date and guidance, kind of precluded from a confidentiality perspective on disclosing the actual launch date.
No, of course. There's there's fine lines with those sort of things as well. What do you think? Obviously, moving forward with a lot of the products that are due to launch and things in the pipeline, what are the biggest risks? In terms of reaching goals in the next 1 to 2 years.
Yeah, I think. There's always risks in any business. I think from our point of view, what we've seen is certainly when you submit a dossier for a complex product with the FDA will ask questions they have every right to do, and we've never had to go back and change a formulation, but they certainly will ask questions and potentially seek more data as things to clarify the approvability of your product. And we're confident that we'll get products approved, but they take time. So the regulatory timeframe, once you submit a product, they have a review cycle. Tends to be around 10 to 12 months, and then they can ask questions which can delay that. So we see the regulatory timeframe as one of the risks if it takes longer than we would like. And competition, obviously, we don't control our competitors. We don't talk to our competitors, but their actions in the marketplace are probably key. They're probably negative ones, but offsetting that, if you look at the time to develop a generic product, generally it's sort of 4 to 5 years, maybe a bit longer, maybe a bit shorter, depending on the product. Which is certainly a lot shorter than, say, a new chemical entity, a new drug for a new disease or for an existing disease. And the cost to develop a product is also quite low relative to a new drug as well. So, I'd offset the regulatory commercial risk by saying also on the positive side, you have a shorter time to market than new chemical entities, and you have lower commercial risk because you're more likely to get the product to market.
Right. That makes sense. And I guess when it comes to the waiting period and the risk in regard to potentially going longer than expected, is there ways you can speed up the process regarding giving the FDA more information or more details, or that's just genuinely just a waiting game?
It's an interesting question. As we've submitted more products, we've certainly spent time thinking through the questions that the FDA has asked on prior products. Creating what we call a risk matrix and identifying issues that they may ask questions about based on sort of historical learnings. We've also engaged a lot with the FDA. So the FDA has a number of different pathways where you can engage with them on a formal basis. There's control correspondence, which is simply you write a letter and you get a response to that letter of your questions within 2 months. We do a lot of those on new products. We also engage with the FDA in what we call pre-development meetings or mid-cycle meetings, which is before we submit a dossier or during the review cycle. Why the FDA might be asking a question, and when you read a question, if you talk to them about it, often you'll understand in more detail exactly what they're looking for. So I think there's some learnings we've had. I think the learnings have been good, and we have I think we've disclosed them in some of our 4Cs, how many interactions we have with the FDA. It's a lot. It's a lot for the products we've got. And that's deliberate and intentional because we think every time we interact with the FDA, we learn and can apply those learnings for future products as well.
Right. Okay, that makes sense. Excellent. So it's sort of, again, it's sort of using what's happened previous as precedent to try and speed up the process and be as effective as possible on your end.
Yeah, that's right.
Yeah, beautiful. We've just had another one come through. How are the sales for the P&L cream progressing? And also, when do you expect to be cash flow positive? So two.
Prilocaine, lidocaine, which is P&L, what was mentioned. It's a large volume product, and this one has had a really interesting history. There's 3 companies competing in that market: Sandoz, Patagus, which is our partner, and Alembic. Those three competitors, there were more in the past. One of the large suppliers in that market exited the market over a year and a half ago. It certainly caused a number of supply chain disruptions, which we and probably other companies also had to face. Lead times for raw material, lead times for tubes took some time. But our market share is certainly ramping up. We believe those supply chain disruptions are over. We haven't seen them recently, and we think there's a bright future ahead for that product. When do we believe we'll be cash flow positive? We'll be cash flow positive for the last 8 quarters. We'd like to make that 8 out of 8 quarters, of course. We have lumpy expenditure and lumpy revenue, but we'd like to be consistently cash flow positive. And part of we don't try and base our success on one product. We have a portfolio approach, like every generic company does. They bring a portfolio to market. And we intend to launch 2 more products in the near future. I think I said 5 months before, which is the case. And we intend to bring more products to market over time as well. And that will drive that cash flow positivity on a more consistent basis. Better bringing more products to market and getting more consistent results from a revenue perspective.
Yeah, obviously the diversifying the portfolio of products. It's obviously you're also trying to capture more market share, right? So again, there's a lot of competition. You can't control the competition. You've just got to control internally, the quality products that you're putting to the market.
Yeah, that's right. And we also take care in choosing well-credentialed commercial partners. So those partners, we give them our baby, if you like. We give them our product that's been approved, and we set up a contract, obviously, a commercial contract between us and a commercial partner in the US in exchange for profit share or royalty payable to us. So an exclusive contract, and that contract governs the relationship between the 2 parties. And those commercial partners we have good relationships with, and we choose them because they're good at executing in the generic market in the United States. And then we'll do the same when we're choosing partners in other parts of the world. We have active conversations going on with a number of companies outside the US, in Europe, Middle East, and some other countries as well. And we'll focus on working with commercial partners that we believe can execute well, and put in place commercial contracts that govern the relationship as well.
Right, perfect. And a lot of it is just those relationships, right? And then leveraging that.
Yeah, that's both our relationship with the commercial partner and our manufacturers, of course. But both of those are important because we're not just focused on one product, we're focused on a portfolio. And the partners that we have, obviously we'll talk to them about our future products as well.
Right.
That's important. Just as our commercial partners' relationships with their customers, the people who actually buy our drugs, are also important. That's one of the things we look at when we're selecting partners for our products.
Okay, right. I'm with you. Now, we've had another question come in from Atish, and you might not be able to cover the whole thing as effectively as they're probably hoping, but it's sort of 2 parts to it as well. How is revenue forecast looking for this quarter, as last quarterly report shown funding only left for 0.6 for 0.6 quarter? Are we expecting any capital raising?
Yeah, obviously we look at our cash flow on a constant basis. We look at this with our board, put together cash flow forecasts as well. We are expecting to launch 2 new products in the next 5 months. That will contribute, and the products we've got on market are also growing as well. And there's a 3rd launch we're planning, which is a line extension of one of our products as well. So cash flow is important. Our 4C discloses the cash balance that we have on hand. We're always looking at our cash flow, our cash balances, and forward projections based on revenue and expenses.
Yeah. So hopefully, Atish, that answers the question for you. Obviously, you probably can't mention too much about any capital raise or anything like that. But I think just before we wrap it up, because there's a lot in the pipeline for you moving forward, and you just want to continue building that portfolio of products, right? But what do you wish investors knew more about the business from your perspective that you think is sort of something that sort of goes under the radar a little bit?
Yeah, we often get questions about individual products, which is fine, no problems, as we have today. And it's okay to talk about those individual products. But we also related that question we often get, which is questions around which is your star product, or when will you launch a huge product. Generics really require a portfolio approach, and that's one thing we're really trying to communicate. We have 15 products, not we have a few on the market, but our intention is to bring all those products to market and really bring a portfolio approach to bear. I think the second thing I would mention is the requirements to develop a generic. They are complicated, but they're much less complicated than developing a new chemical entity, and the risks of development are lower. So they're two important points. And I think probably the third point, there's around 100 life science companies listed on the ASX. A lot of them are quite small. We're a real company. We have over 30 employees. Most of those are scientists. So we're developing products ourselves in our laboratories in Melbourne. Clearly, we work with manufacturers and commercial partners in the US. But we control our developments through our own staff. And I think that's an important and misunderstood part of the company as well.
Right. Yeah, I think, and that's a big thing. Investors want to know, internally, how's the business look? What's the structure? What's the foundation? Right. So obviously, it's good you can get your point across a little bit there today. Now, before we wrap things up, I've got one last question. Because again, you've probably got your own opinions on the whole thing, but where do you see your biggest growth opportunities in the next 2 to 3 years?
That's quite easy. The products we've got on market now, we know that the data from industry data or from our partners, those products are growing, and we're launching additional products. So our revenue will naturally grow from those products. They're the biggest opportunities we have. Interestingly, I think we'll also leverage the FDA approvals into other markets. Conversations and discussions we're having there are quite promising. We know that the FDA is a sort of gold standard regulator, as is the TGA and European authorities, but clearly the FDA approvals spark interest in commercial partnering outside the US, and we're pursuing a number of parties and discussions there. So that's an upside that we haven't baked into our forecasts, but we see potential there as well.
Yeah, I mean, I've been following the business for a while now, and again, there is a lot of potential, and it's a lot of waiting sometimes with those FDA approvals, and you just got to sit tight, and investors, obviously, loyal investors, hopefully reap the benefits.
Yeah, well, that's what we all hope as well, of course. And we've certainly demonstrated our ability to get product approvals, our ability to get products approved and onto the market. And we need to consistently keep on demonstrating that, bring more products to the market, grow our revenue base, and continue to fill that pipeline with attractive products.
Yeah, exactly right. Well, I think you've got the right team behind you, and it sounds like a lot of things are heading in the right direction. But Michael, again, I want to thank you for your time. I know you're a busy man, and to be able to come on here, do a little bit of presentation for everyone watching, it's always good for new investors or current investors as well. So again, thank you. Another Sharewise webinar done and dusted. But Michael, you have a lovely afternoon. If anyone has any questions for Michael, be sure to reach out to him. Like he said, you can get in contact with the business. Reach out to Sharewise. We can get in touch with Michael. And as I said, it is recorded, so you can always rewatch it if you missed a few things. But again, everyone have a lovely, rest of the evening, and enjoy your day.
Thank you, Harry, and thank you, Sharewise, and thank you, attendees.